Hi, this is the 2026 Health Benefit Overview for Tri-County Electric Cooperative. My name is Courtney Rollison, and I'm here to help you throughout open enrollment for any support or questions you might have. You can reach me at courtney@abentrus.com or call me at 904-285-3300. I do have an internal partner, Brittany Medlin. She is there throughout the year for any claim issues, insurance coverage questions, or ID cards. You can reach Brittany at brittany@abentrus.com and the same phone number. Health Benefit Open Enrollment is the one time a year where you do have the opportunity to make changes to your health benefits. At this time, you can add or change dependents or change plans. Outside of this time period, you must have a life event to do so. A life event would be something such as the birth of a baby, a marriage, a divorce, an offer of other coverage, or a loss of other coverage. If this should pertain to you, you need to let either your human resources, Brittany, or I know of that event within 30 days. It can be 30 days before the event or 30 days after the event. Outside of this time period, however, we do not have the power to make the change. Great news! Tri-County Electric is staying with Florida Blue for medical insurance. You do still have the same 4 plans that you had last year. On all 4 plans, you do have in and out of network coverage. You're on a national network, so you do have coverage no matter where you are throughout the nation. On all 4 plans, your preventative care is 100% covered as long as your doctor codes it as preventative. That's going to be your annual physicals, your well exams, your mammograms if you're over 40 or if it's medically necessary, and your colonoscopies if you're over 45 or if it's medically necessary. Just talk to your doctor. Make sure that they know you're there for your preventative care check. If you do go in and you start talking about aches and pains, you have headaches, knee injuries, etc., and they code it as diagnostic, you will be charged. So it strictly must be a preventative care visit. Okay, let's talk about your first plan, Blue Options Plan 05904. On this plan, your calendar year deductible is $2,500 for an individual or $7,500 for a family. What does that mean exactly? That is only going to apply down the column where you see CYD. For those CYD services, it stands for calendar year deductible. So for any of those services, you're going to pay the full Florida Blue negotiated rate. If all of the combined bills ever do total your deductible, then you're going to move on to coinsurance, which is 20% on this plan. So after that, you're just paying 20% of any of the negotiated rates. If all of your combined medical expenses ever totals your out-of-pocket maximum, which on this plan is $6,000 for an individual or $12,000 for a family, then you're capped out for the year. You have no additional medical expenses. Florida Blue picks up 100% of anything additional. On this plan, you do have true copays for a lot of your services, so you know exactly what you're going to pay. For primary care, there's no deductible involved. It's a flat $35 copay. Specialist, $65 copay. Your teledoc visits, it's through Blue Virtual Care, and we'll talk more about that. For your diagnostic lab, as long as it's coded as medically necessary and you stay in network, it's zero charge. X-rays, $65 flat copay. Advanced imaging, $450. In an outpatient hospital in the emergency room, you're paying the negotiated rate for those services. If you ever do meet your deductible, then it's just 20%. For urgent care, it's a $70 copay. Mental health is zero charge. For your prescription drug card, this is very important. On this plan, it's generic only. It's $10 for generic. For select brands, you're going to pay the greater of 20% or $50 up to $200. And non-preferred is not covered at all. If you would like me to send you the formulary, please do reach out and I'll email that right over to you and you can look up your drug and make sure it is covered on this plan. You can save money on this plan with a 90-day supply via mail order. And you do have out-of-network benefits, but it does pay to stay in network. Your next plan option is Blue Options Plan 05774. On this plan, your plan year deductible is $3,000 for an individual or $9,000 for a family. Remember, that's only going to apply down the column where you see those CYD services. On this plan, you do have more copays, so you know more what you're going to pay. Your out-of-pocket maximum on this plan is $6,350 for an individual or $12,700 for a family. Remember, every single service goes towards that out-of-pocket maximum. Your coinsurance after you meet your deductible is 20%, and preventative care is 100% covered as long as it's coded as preventative. Primary care doctor, it's a $40 flat fee. Specialist, $100. Your Teladoc is no charge using the Blue Virtual Care. Diagnostic lab is zero cost as long as it's medically necessary and in-network. X-rays are $50 flat fee, advanced imaging $400. Inpatient hospital, it's $500 per day. And then you're also going to pay the negotiated rate till you meet the deductible. Once you meet that, then 20%. Outpatient hospital is the negotiated rate till you meet your deductible. Once you meet that, 20%. Emergency room is a $400 flat copay, urgent care $100. Mental health for inpatient, it's $500 per day plus the negotiated rate till you meet your deductible. Once you meet that, then 20%. Outpatient, right off the bat, it's the negotiated rate till you hit your deductible. Once you meet that, 20%. You do have a full prescription drug card on this plan. It's $10 for generic, $50 for brand, and $80 for non-preferred. You can save money with a 90-day supply via mail order. 90-day supply of generic is $25, $125 for brand, and $200 for non-preferred. You can save money going in network, but you do have out-of-network benefits, so please try and stay in network if you can do so. Your next plan option is Blue Options Plan 05781. On this plan, your calendar year deductible is $1,500 for an individual or $4,500 for a family. If you meet that, you're responsible for 30% coinsurance. Your out-of-pocket maximum on this plan is a little bit less than the others. It's $5,500 for an individual or $11,000 for a family. Remember, preventative care, no cost as long as it's coded as preventative. Primary care doctor is $30, specialist $55. Your Teladoc through Blue Virtual Care is no charge. Your diagnostic lab is $0 as long as it's medically necessary, and you stay in network. X-ray is $50, advanced imaging $250, inpatient hospital, it's the negotiated rate till you meet your deductible. Once you meet that, 30%. Same with outpatient hospital. Emergency room is $250 copay, urgent care $60, mental health, inpatient, and outpatient is the negotiated rate till you hit your deductible. Once you meet that, then 30%. Full prescription drug card, $10 for generic, $50 for brand, and $80 for non-preferred. And again, save money with a 90-day supply via mail order, $25 for generic, $125 for brand, and $200 for non-preferred. You do have out-of-network benefits. It does pay to stay in network. And your final plan option, which is the richest plan, is Blue Options Plan 03359. On this plan, your calendar year deductible is $1,000 for an individual or $3,000 for a family. If you do meet that, you're just responsible for 20% coinsurance. Your out-of-pocket max is the lowest on this plan. It's $4,500 for an individual or $9,000 for a family. Preventative services are 100% covered as long as they're coded as preventative. Primary care doctors, $35, specialist $60. Blue Virtual Care is no charge. Diagnostic lab is $0 as long as it's medically necessary and in network. $50 for x-rays, $125 for advanced imaging. Inpatient hospital, you have two choices. A normal hospital is $500 a day to a $1,500 max. Option 2 is a teaching hospital. It's going to be a little bit more. It's $800 per day to a $2,400 max. Outpatient hospital, again, option 1 is $150, or option 2, a teaching hospital, is $250. Emergency room is $500. Urgent care is $65. Mental health inpatient is $500 per day to a $1,500 max. Outpatient is $150. Same prescription drug card, $10 for generic, $50 for brand, and $80 for non-preferred. You can save money with a 90-day supply via mail order, $25 for generic, $125 for brand, and $200 for non-preferred. And again, you do have out-of-network benefits, but if you stay in network, you save money. Great news! For Blue Options Plan 05904, the employee only, employee spouse, employee child, and family costs are staying at zero. For all of the other plans, the cost is on the screen. It's a semi-monthly full-time employee premiums. Remember, if you're currently on a Florida Blue plan, they do not send out new temporary ID cards or new ID cards. If you need one, please let Brittany or I know and we'll go ahead and order one for you. Hopefully, most of you do know about the health reimbursement account by now. It's a huge benefit that Tri-County Electric provides for those of you that do have higher medical costs. On Blue Options Plan 05904, as an employee only, if you reach your deductible, they're going to reimburse the last $500. And as a family, employee only, the last $1,500. If you do reach your out-of-pocket max, then as an individual, Tri-County will reimburse the last $2,000, and as a family, the last $3,500. On Blue Options Plan 05774, for employee-only coverage, if you reach your deductible, Tri-County is going to reimburse the last $1,500, and for a family, the last $3,000. If you then again reach your out-of-pocket max, as an individual, Tri-County is going to reimburse the last $1,350, and as a family, $2,700. For Plan 05781, if you reach your deductible as an individual, they're going to reimburse the last $500, or as a family, $1,500. For your out-of-pocket max, if you do reach that, they're going to reimburse the last $2,000 as an individual or $2,500 as a family. And finally, for Plan 03359, if you're an individual and you do reach your your deductible, they're going to reimburse the last $500 for employee only, or for a family, $1,000. If you do reach your out-of-pocket max as an individual, they're going to reimburse the last $500 as an individual or $1,000 as a family. Finding an in-network provider is easy with Florida Blue. Simply navigate to floridablue.com. There you can register and find an in-network provider, view your claims, and see your ID cards. You can also download the app, the Florida Blue app, on your smartphone. If you are outside of the state of Florida, finding an in-network provider is easy. You're going to go to bcbs.com. Click on Find a Doctor. They're going to ask you for your plan prefix. Your plan prefix is on your medical ID card, but it is XJB. There you can look up in-network providers. All 4 plans allows access to Blue Virtual Care. Blue Virtual Care provides 24/7 access to a doctor. That is no cost to you. You would go to either your Florida Blue app or floridablue.com. There you're going to register, provide your medical history, and then you talk to an intake agent. You tell them what your issues are, and a doctor is going to call you back in a few minutes. They can help you with so much, from sinus infection, fever, cough, sore throat, rash, allergies, upset stomach, nausea, and much, much more. The call is no charge, so please take advantage of this no charge, very fast service. Florida Blue does have a wellness program. It's called Better You Strides. That's your map to your personal path to health. They can help you improve nutrition, increase activity, and build healthy habits. They can connect to over 140 mobile fitness partners. So please do take advantage of Better You Strides. Know before you go. Remember, preventative care is 100% covered only if your doctor codes it as preventative care. So absolutely have the conversation with them. Dependents are covered until the end of the year that they turn 30 for medical and up to their 26th birthday for dental and vision. Big hospitals, big bills. Anytime you can go to a freestanding facility, it's going to save you a ton of money. And urgent care centers versus emergency rooms. Urgent cares are going to be so much less expensive, save you so much money and time. Your flu shots are 100% covered. If you go directly to the pharmacy, you put your arm over the counter, it's no charge. If you do go to your doctor or a convenient care clinic, they will charge you the copay. So just strictly to the pharmacist. Are you close to age 65? Well, I do have some important information for employees eligible for Medicare. If you're currently enrolled in that plan 05904, this is the zero cost plan for every tier. And you plan to enroll in Medicare, please be aware that the prescription drug card included with this plan is considered non-credible coverage. Because this plan provides coverage for generic medications only, it is not expected to pay on average as much as standard Medicare Part D prescription drug coverage. So you should not elect this plan. Your dental coverage is going to be with MetLife. You do receive 2 free teeth cleanings. They're absolutely free, no deductible involved. For your basic and your major services, you do have a one-time per year $50 calendar year deductible up to 3 people in your family that do have a basic or your major service. You do have $2,500 per year per member to spend on dental services. Your basic services are covered at 100%. That's your full mouth x-rays, extractions, endodontics, and periodontics. Your major services are covered at 80%. That would be your crowns, dentures, and implants. You do have orthodontia coverage for your children up to age 19, one time per lifetime in the amount of $2,000. You can keep your children on the plan till age 26, and the employee semi-monthly deductions is on the screen for you. Finding an in-network provider with MetLife is easy. Simply go to mybenefits.metlife.com. There you're going to be asked to enter in your employer name. So Tri-County is going to pop up. You save that down. You enter in your demographics and your account will be established. There you can find in-network providers. You can print out your ID card because remember MetLife does not send hard ID cards. All you need to do is provide them your social and let them know you're with MetLife. And you can view all your claims. If you ever feel you've been billed incorrectly, this is where you would go, download that claim, shoot it over to Brittany, and she can research that for you. Vision insurance is staying with the standard. And remember, you're with the VSP network. Okay. You can get your yearly routine eye exam for no cost. Your contact lens exam copay, you receive a 15% discount. Your materials, single, bifocal, trifocal, and lenticulars are covered in full. Your frames, you have a $130 allowance, and your elective contact lenses, you have a $130 allowance. If you need medically necessary contacts, this means you cannot wear glasses, then your medically necessary contacts are covered in full. You do have out-of-network benefits, but your in-network benefits goes much further. You can keep your children on the plan until age 26. You can get your eye exam, spectacle lenses, and contact lens exams once every rolling 12 months, and your frames once every rolling 24 months. Finding an in-network provider is easy. You're going to go to vsp.com/eye doctor. Then click on Find an Eye Doctor. Your employee semi-monthly deductions are on the screen for you. If you need any help throughout open enrollment, I'm there for you. You can reach me at Courtney@Abentrus.com or always give me a call at 904-285-3300. And remember, throughout the year, Brittany is there for claim issues, insurance coverage questions, or ID cards. You can reach Brittany at Brittany@Abentrus.com and the same phone number.